gather my supplies and enter the patient's room. Knock, knock.
Are we filming? Oh, shoot, I am sorry.
It's okay.
Hello.
Hi, I'm Lincoln. I'm a student nurse with Tarrant County College. I'm here.
Hi, Lincoln.
Hi. How you doing?
I'm pretty well.
Good, glad to hear it. I'm here to do a head-to-toe assessment on you. Basically mean I'm going to be looking, feeling, and listening around just to see where you're at today.
Sounds like a lot.
I'm not going to take up too much of your time. You mind if I get started?
Go ahead, man.
Awesome.
I'm yours.
Thank you so much. So, are you in any sort of pain?
No.
No? Awesome. Before we get too terribly far into it, that sounded necessary, may I get from you your name and date of birth?
Oh, I know this drill. My name is Michael Morales, 10/19/1988.
Okay, awesome. Thank you so much. And do you know what year it is?
2022.
Okay, very good. You okay?
This is me normally.
And do you know who the current president is?
Biden.
Very good. Patient is alert and oriented ×4, is well groomed with no speech deficit, and is dressed appropriately for the weather. So we're just going to start off at the top and work our way down. If any pain or anything does start to come up, just let me know. Otherwise, I'm going to get started.
All right.
Do you wear any sort of glasses or anything like that?
I do not.
No? Awesome. Okay, so go ahead and follow the tip of my pen here, just with your eyes. Eyes are Perla. Now follow it with your whole head. Awesome, thank you so much. Can you tilt your chin up for me? A little too far.
All right.
Any previous trauma to your nose, any nasal surgeries or anything like that?
I may have broken it once or twice, but I think that's it.
Okay. Has it ever been like offset?
No.
Okay. Go ahead and say ah.
Ah.
Okay. Patient is alert and oriented ×4. Eyes are Perla. Oh, can you go ahead and pull down on your bottom eyelids for me? Conjunctivas are pink and moist, and sclera is white with no discharge. Do you wear any hearing aids?
I do not.
Thank you so much. And while you're here, no jugular vein distension observed. Oral mucosa is pink and moist with no redness towards the back of the throat. All teeth are present and intact. And patient denies any sort of surgeries and without the use of hearing aids. Can you go ahead and shrug for me? Awesome, thank you. So, next we are going to listen to your chest sounds. So I'm going to start off with your heart, and then I'm going to listen to your lungs next. I'm going to be giving you some instructions along the way. But before we get to that, have you ever had any sort of chest surgeries that you're aware of?
Can't say I have.
Okay. So, do you have any lung problems that you're aware of? No shortness of breath?
Nope.
Asthma, COPD? Do you use oxygen at home?
I do not.
Awesome. Cool. Now, what about for your heart? Have you ever had any sort of heart surgeries?
No.
Cool. Have you ever had a history of chest pain, shortness of breath, anything like that?
Only when I work out.
Okay. What about your cholesterol? Has your doctor told you about anything about watching that?
I've had a bunch of tests taken, and they never said anything, so I assume it's good.
Awesome. Sounds like you're as healthy as an ox. So I'm going to listen to your heart first in about 5 places, 1, 2, 3, 4, 5. And then after that, I'm going to listen to your lungs, and then I'll tell you, I'll let you know when, but I'm going to listen in quite a few spots, and I'll just need for you to take a deep breath with each one, okay?
Okay.
I will remind you. You're starting off with aortic. Herb's point. And the tricuspid. And the mitral. All right, heart sounds were at a normal rate and rhythm. No murmurs. If he did have a murmur or any sort of irregular heart sounds, we'd listen to the apical pulse of the mitral valve for 1 full minute. So next we're going to listen to your lung sound. So now, whenever I move my stethoscope, I want you to take a nice deep breath from me, okay?
All right.
Go ahead and start. And begin. One more. Awesome. Now lean forward some. We're going to do the same thing on the back side. Go ahead and start whenever you're ready. All right. So lungs. Getting so relaxed, huh? So lung sounds are clear across all lobes with no adventitious sounds observed. Breathing is unlabored with no use of accessory muscles. No nares are flaring, and breath sounds are deep. Before we get too much further, are you able to swallow?
Yep.
Awesome. How's your chewing?
Pretty good. Haven't had problems.
Cool. How would you say your diet is?
My diet's normally pretty good.
Okay.
School's changing a little bit. Normally it's pretty good.
Okay. Would you rate it as being overall good?
I would say overall it's pretty good.
Okay. Awesome. How are your bowel movements today?
Regular.
Regular? Okay. Can you talk to me about frequency, consistency? How does it look? How does it feel?
Soft.
Soft.
I eat pretty organic, so it kind of just goes straight through me.
Okay, cool. So is it difficult?
Nope.
No? Okay. Awesome. And how many times per day would you say that you go?
Oh man, it varies. Let's call it an average of 3.
Okay. Now, what about urination? How much water do you drink in a day?
Oh, a lot. Gallon, at least.
Oh, okay. And do you hit that goal regularly?
Yep.
Awesome. Now, what about when you actually urinate? Does it burn? Is it difficult?
Nope.
Have
It's
problem?
clear.
Okay, cool. Patient does not have a urinary catheter. If he did, we would assess it for patency and signs of infection. I'm going to lean you back just a little bit because now we're going to go into your abdomen. And so I'm going to be listening first, then I'm going to be feeling around a couple times just to see if it hurts or if we have any sort of enlarged organs. Okay. Have you ever had any sort of abdominal surgery or anything like that?
No.
No? Okay. So abdomen is flat upon inspection. I would have lifted his shirt up with no adverse findings upon visual inspection. has normal active bowel sounds across all 4 quadrants. I'm going to start feeling around, okay? Let me know if anything hurts. Nothing hurting?
Nope.
Okay, we're going to go a little bit deeper now. Checking to see if you have any enlarged organs or anything like that. Okay, so no lumps, lesions, or enlarged organs or pain reported or observed. There was no muscle guarding, and everything was got no negative response from the patient. So I'm going to sit you back up. Mr. Morales, are you okay?
Yeah.
Yeah? Alright, so I'm going to be looking at your pulses, starting off at the neck. Okay. Jugular vein has a +2 bilaterally. Next we're going to go to your radial pulses.
Take my watch off real quick.
Thank you. Also +2 radial pulses bilaterally, equal and strong. While we're here, I'm gonna actually look at your, I'm gonna be pinching your fingers and doing some hand assessments just to
Okay.
look at your circulation. You did say you were pretty well hydrated. So just testing your capillary refill and tissue perfusion. And capillary refill is less than 3 seconds. Skin turgor is elastic. Awesome. Now go ahead and grip my fingers as hard as you can. Awesome, thank you. Grab my hands. Pull me towards you. Push me away. Awesome. Now what I'm going to have you do is stick your hands out in front of you. Put them all the way up. And back down. And then out as far as you can. And then back to resting. Thank you so much. We are going to do the same thing around your legs. So I am going to uncover your feet. So to about here. Lift your legs one at a time against my hand. Okay, up and up. And then raise it, let's bring it down. And then out to the side. And then bring it in. We're gonna do the same thing over here, lift it up. And then down. And then out to the side. And then in. Awesome. So, go ahead and bring your toes to your nose. Awesome. And then press on the gas. Thank you. We're gonna check your toes. Same thing, capillary refill. Capillary refill in the toes is less than 3 seconds. There's been no cyanosis observed in the lips, hands, or in the feet. I'm gonna check your posterior tibial pulse, which is equal and strong, +2 bilaterally. And then your dorsalis pedis pulse, also +2 bilaterally. Skin has been warm and dry throughout the whole assessment, with no IVs. Skin pigmentation is normal across all areas, and he has no, has a scar right here on his foot. What happened here?
No idea. I'm still trying to figure it out.
Okay, so it hasn't been affecting his range of motion at all. Does it hurt?
No.
No? Okay. So aside from the scar on his foot, or for his ankle rather, there's been no other lesions noted. So, before we finish, I would like to see how you walk. So, I'm going to lower you down so you don't have to hop and hop. Oh, that's one. Okay. So, after you throw your socks on, I'm gonna have you walk for me. So go ahead and walk towards me. Awesome. Go ahead and stop. Now, when you're walking back, I want you to walk heel to toe. Okay, awesome. Thank you so much. You can go ahead and have a seat. Yeah, patient has no IV lines, no sort of wound dressings that need to be changed. So I'm going to leave him in the low position with collar in reach. And I'm going to cover him back up, get him comfortable. Do you have any questions for me before I pop up out of here?
No, you're way better than my last nurse.
Well, thank you so much.
Don't tell him that though.
Oh, this stays between you and I.
All right, great.
So, wheels are locked, bed's in low position with call light in reach, area is free of clutter, and I'm bringing the patient's belongings back within reach. I'm going to doff my gloves, perform hand hygiene, and exit.